We are joined by Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Welcome back to the Forum Daily, Dr. Raut.
Thanks so much. Pleasure to be here.
So let's start with the AstraZeneca vaccine. How does it work compared to the already approved Pfizer-BioNTech and Moderna vaccines?
The AstraZeneca vaccine, it's made from a weakened form of the common cold virus. So it's modified in many ways to look like a coronavirus, so it can't cause the illness. And so scientists take the genes from the spike protein of the coronavirus, put them on this harmless virus to make the vaccine. Then we take the vaccine and we inject it into our patient. The patient will start producing the antibodies against these spike proteins, and that's what builds the immune system there. So a very nice different approach to it.
And what do we know so far about how these vaccines work against new variants of the virus?
Well, I think the new variants will cause a lot of issues, especially the South African variant here. In the simplest terms, it's still that E484K mutation that actually changes how the body recognizes the virus. And it has this potential to make vaccines not as effective. It makes the Pfizer slightly less effective. Moderna is still effective, but the immune system may not be as strong. And AstraZeneca might have limited efficacy in the South African strain.
And now we have this Brazil variant in Canada. How does it compare to the South African and UK variants that were detected earlier?
So according to the U.S. Center for Disease Control, the concern with this particular strain is it has 17 unique mutations. A lot of these mutations, 3 in fact, are related to how that spike protein works. We still don't have too much evidence on how contagious the Brazil variant is, but it shares enough mutations, especially that E484K, which means that there's likely going to be some issues with even the vaccinations and also the transmissibility rates.
All right, Dr. Raut, we've got over 2 minutes left, but I really want to get into this study on viral loads. So what exactly are viral loads? Let's start with that.
Sure. Viral loads are basically the amount of virus that's in an infected person's blood. So we take a blood sample to figure that out. The viral loads are important because a higher viral load may tell us that the infection is being too strong, and a low viral load shows the suppression, but it also tells us the spread. A low viral load means it's likely to spread less from person to person.
And what do we know so far in terms of how vaccines work on the viral loads of patients?
That's been good news so far. The Pfizer vaccine, at least, has shown that decreased viral loads, almost a 4-fold decrease there. So that is a big win for us there.
So what is this study suggesting, Dr. Raut? Does this mean that maybe the Pfizer-BioNTech vaccine is the best choice for reducing spread?
So far, we have the most data with Pfizer. I would say that if we really studied the other ones, I'm sure we would get similar data on them. But so far, just based on the studies alone, it looks like the Pfizer one tends to have the most studies and definitely the most efficacy.
All right, Dr. Raut, a little over a minute left, but how should Canadians who are considering vaccination react to this information in terms of concerns around taking the wrong vaccine?
I think it's an understandable concern. So different companies here producing very different products and many different options. But at the end of the day, all of the options do demonstrate some level of reasonable efficacy. And so the importance here is to not necessarily delay on that. And if you have the opportunity to be vaccinated, you should absolutely go for it. Remember, for Canadians right now, our biggest hurdle isn't choice, it's availability. And so if you're desperately hunting for toilet paper, the difference between 1-ply and 3-ply, pretty small.
All right, Dr. Raut, Appletree Medical Group Medical Director, thank you again for your time on Forum Daily, sir.